Hi, my name is Christian Erikstrup, and I'm a chair professor of clinical immunology at Aarhus University Hospital and Aarhus University. I'm going to talk about the Danish blood donor study, a biobank with 3 million samples. So imagine a platform that enrolls participants, obtains consent forms, gathers questionnaires, and collects blood samples. Additionally, this platform provides access to serially collected blood samples, and it enables re-engagement with participants for further phenotyping on new studies. We've had this in the Danish blood donor study since 2010, offering a cost-efficient inclusion by the use of the Danish blood centers infrastructure and our unique national health registers. So what we do in the Danish blood donor study is to ask a blood donor at a donation whether he or she wants to participate. If the donor consents, after the consent form is signed, we will ask the donor to complete a questionnaire on their own cell phone or on a tablet. We have included now more than 180,000 participants, and all the data has been linked to national health registers in a national supercomputer. More than 140,000 participants have been chip genotyped, and with their consent, it opens up for the use of quality control samples collected at all donations for research. So we have now access to more than 3 million samples. Around 600,000 questionnaires have also been collected over the years. And very importantly, we have the consent of our participants to be recontacted and invited into new studies that could be based on a specific phenotype or genotype. You can read more about the Danish blood donor study in this cohort profile article. So the Danish blood donor study is all about sequential pre-disease data and samples. We can follow individuals from health over pre-disease states and until disease develops. When we started out doing the Danish blood donor study, we had the UK Biobank as our role model, and it's a fantastic resource, but they have in general one sample per participant. We have in the Danish blood donor study an average of 15 samples per participant. So if you have a biomarker for a certain disease that you want to study and follow that biomarker over time before a diagnosis, we can pick relevant samples and measure the biomarker before the diagnosis. Blood donors are healthy at inclusion, but some will develop a disease. And this is just an example of the number of events we have for cardiometabolic diseases. More than 5,000 individuals have developed type 2 diabetes, and from these individuals, we have more than 80,000 samples. Blood donors help others not only by donating blood and plasma, but also by advancing research for future patients. We have a unique platform in the Danish blood donor study. We collect sequential data and samples before disease develops, and we also have the opportunity to recontact participants. By partnering with you and other experts, we can make even better use of the platform, and we are always open to new collaborations. Thank you.